Well, I'm Dr. James Stephenson, MD, board certified occupational medicine, and a certified federal examiner for the Department of Transportation. This video series is designed to help you pass your next DOT physical on the first try, maintain your employment status, and be in full compliance with federal regulations that both you and your employer are under. Today, we will discuss our and its treatment. The DOT standard is having adequate prehensile strength to control the steering equipment in the commercial vehicle you are using and have adequate strength to control foot pedals in those vehicles. Fortunately, arthritis treatment has massively improved with the development of disease-modifying agents, DMARDs, such as methotrexate, which is brand name Humira, Interna, which is brand name Enbrel, Flex, which is brand name Remicade, Tofel, which is brand name Xeljanz, Veru, which is brand name Secu, which is brand name Cosentix, brand name Rimvoq, and Raz, which is brand name Rizzi, and others. Because DMARDs suppress part of your immune system that can make you more susceptible to infections. A test for exposure to tuberculosis is required prior to health providers prescribing these drugs. Routine blood tests are also necessary to ensure your liver and kidneys are processing the medication safely. Regular care with your prescribing health provider is recommended. The DOT examiner may test your grip strength, finger, hand, and wrist range of motion, and foot, ankle, hip, and knee range of motion, and plantar foot strength as part of your examination. If you have had an arthritic joint replacement, we will now discuss returning to commercial work after that procedure. Again, the DOT standard is having adequate prehensile strength to control the steering equipment in the commercial vehicle you are using, the ability to reach overhead to secure loads and reach overhead controls, and have adequate strength to control foot pedals in those vehicles. First, you will need a clearance letter from your orthopedic surgeon clearing you for return to work, a copy of which you will give to the federal examiner. During recovery from your surgery, inform your physical therapist of your job duties and activities so they can tailor the therapy to your return to work. The federal examiner may have you circumvent your shoulders overhead to check shoulder range of motion. Squeeze their crossed fingers to check grip strength. Observe your gait, squat, and have you push your feet against their resistant hand to gauge your strength and your ability to push commercial vehicle foot pedals. Please consult with your personal health providers for additional advice. This video is informational only and is not intended to create any doctor-patient relationship or provide specific individualized medical advice. If you have found this information helpful, please give us a like and subscribe to our YouTube channel, whereupon additional health issues affecting those being past their DOT physical will be discussed. Stay safe out there. We appreciate all that you do.